Hey, I'll see you on tour in Las Vegas, Chicago, and Grand Rapids. In Chicago, it's stand-up and a live panel show. Go to jimmydore.com for a link for tickets, and make sure you go to jimmydore.com. Okay, so on this show, I've been a big supporter of Medicare for all. Every other civilized country has a version of it. They're not perfect, but they're better than the system we have, and that's why I did Force to Vote. That was my big activism. And so there's a new article. It's an article in Common Dreams. Easy to pay for something that costs less. A new study shows Medicare for all would save us $5.1 trillion over 10 years. Come on, could that be? The U.S. has the most expensive healthcare in the world. We pay roughly twice as much as everybody else, and we have worse results, right? So per capita, we spend $12,300 per person in the United States. And believe me, we don't have as good of results as Germany, which is next much, which is almost half, $7,300, right? So then Sweden, $6,000. Canada, $5,000. United Kingdom, $5,000. Italy, $4,000 per person. That is such a... And they have great health care. South Korea, Poland, look at that, 2,000. So that's just give you a comparison. Now, confronting the question most commonly asked of the growing number of Americans who support replacing America's uniquely inefficient and immoral for-profit healthcare system with Medicare for all, how do you pay for it? I've been asked that a million times. A new paper released Friday by researchers at the Political Economy Research Institute shows that financing a single-payer system would actually be quite simple, given that it would cost significantly less than the status quo. It's easy to pay for something that costs less, says this guy over at the thing. And he says, so he's at the Sanders Institute gathering in Burlington, Vermont, where Poland unveiled the paper for the first time. According to this 200-page analysis of Senator Bernie Sanders' Medicare for All Act of 2017, U.S. healthcare expenditure figures, the cumulative savings for the first decade operating under Medicare for All, meaning Bernie's plan, would be $5.1 trillion, equal to 2.1% of cumulative GDP without accounting for broader macroeconomic benefits such as increased productivity, greater income inequality, and a net job creation through lower operating costs for small and medium-sized businesses. That's the big thing. It's incredible the amount of money that just my small business has to pay for healthcare insurance, which is not healthcare, just the insurance for our employees. It's a crazy high number. And I can't believe that more businesses... Well, let me ask you, Paul, why do you think more businesses don't demand that the government provide health care so they don't have to, because it's such an expense? And my theory is that, well, that's one way to keep their workers kind of in check. Like you can't job hop as easily because your health care is tied to your employment. When I tell that to people in other countries, it blows their mind. So what do you think that businesses haven't demanded it?
I think businesses are of a mentality on the creation side, and the government is duck and cover. And so the mindset that's running a business isn't going to necessarily be eager to trust something it doesn't believe it'll deliver for them or their employees. And yes, a corporate entity would want to secure great workers and kind of lock them in or say, hey, let's work this out, because if you leave, you have to start all over with the healthcare stuff. Why don't we talk? Why don't we work it out? Because a company exists by people. It's a collection of people working in a common goal. So that makes sense, even though it doesn't sound fair when you put it in the harsh light of what's great for the individual human being. A company does have a job to do. It's to market something, sell something, and turn a profit. And so when you look at someone who's of the mindset like yourself, Jimmy, for profit, you just care a great deal about this tragedy in America where folks could be here and many could go get whatever surgery they want with the snap of a finger, and so many others are going to sit forever in an emergency room and wait hours to get mediocre care for something that's really serious, like they may have broken their arm framing a house. And they don't have health insurance. And it is a tragedy. I think the Achilles heel to the solution is you hoist a hell of a lot more patients onto a workforce of doctors and nurses that are already burdened. there'd have to be some kind of incentive plan to help grow a new crop of physicians to come up and as the demand increases. But that's just me thinking out loud. Thank you for asking me for what I would think about.
Yeah, I mean, Cuba does it. You know, somehow a socialist nightmare place like Cuba.
But a better example is Italy. They have the oldest population on the earth.
Yeah,
or one of them. Yes. So when COVID was hitting, you know, Italy's like, oh God, it's one of the oldest populations on the earth, one of the oldest, largest collection of older folks, you know, by a country, by its borders, and they're a third per capita of what the U.S. spends. That's a hell of a thing to notice.
And, you know, so $5.1 trillion savings, that would pay for a lot of new students going to nursing and medical school, you would think. Yeah. Or we could think of how many Ukraine wars we could fund.
Yeah, right. There's that, too. That's a lot. 5.1 trillion. You could probably buy Russia for that.
Yeah, right? Yeah.
Get them to just stop.
So there's a little more to this article. Let me get... No, I liked actually... When Tulsi Gabbard ran for president, I was a supporter of hers for many reasons. One of them was that she supported Medicare for all, even though people pretend she didn't. She didn't support Bernie's version of Medicare for all. She supported the Australian version, which is you can buy your own private health insurance if you want. So if you want to have a private room when you're in the hospital or you want to get certain other procedures, you can get that, and you can buy health care coverage for that. I support that. I think that that's a nice mixing, and it makes people feel a little bit more in control and have a little bit more power over their health care than just having to. So I'm for that. So, and that's always been a lie that people go like, oh, Jimmy says he supports Medicare for all, but he supports Tulsi, and she didn't. No, she didn't support Bernie's version. She had her own version. And Australia's healthcare system in some is considered one of the best in the world. So the most significant sources of savings from Medicare for all, the researchers found, would come in the areas of pharmaceutical drug costs and administration. In a statement, Paulin said his research makes abundantly clear that the moral imperative in guaranteeing decent health care for all does not at all conflict with the goal of providing cost-effective care. The most fundamental goals of Medicare for all are to significantly improve healthcare outcomes for everyone living in the United States while also establishing effective cost controls throughout the healthcare system. These two purposes are both achievable. As Michael Leidy, Sanders Institute Fellow and former Director of Public Policy for National Nurses United, put it during a gathering on Friday, we really can get more and pay less. The official rollout of Perry's analysis came on the heels of a panel discussion of the moral urgency of Medicare for all, particularly among a time when tens of millions of Americans are uninsured. Life expectancy is declining, and thousands of families are bankrupted by soaring medical costs each year. I was once bankrupted from medical costs. Far from being an unaffordable pipe dream, Columbia University professor Jeffrey Sachs, friend of the show, who introduced the panel at the Sanders Institute gathering on Friday, argued that the study shows Medicare for all offers a proven and wholly workable way forward. Medicare for all promises a system that is fair, more efficient, and vastly less expensive than America's bloated, monopolized, overpriced, and underperforming private health insurance system. America spends far more on healthcare and gets far less for its money than any other high-income country. I would bet that if we went to Italy and we went and used their medical system, that we wouldn't feel like we were being gypped or getting lower quality care. But look at how much less they're spending per person. And it's because they don't, first of all, if you cut out health insurance companies, that's like a third of your cost at least. And a health insurance company, their whole job is to try to deny you coverage because that's what increases their profits. And my whole idea is to get a capitalist out from in between me and my doctor. So if I have a G-man, a guy from the government sending a check, so the whole thing is they're not going to turn hospitals into government hospitals. All the doctors aren't going to be government doctors. They're still going to be private hospitals and private doctors. But now instead of my insurance company sending them a check, the government's going to send them a check. So I get a capitalist out from in between me and my doctor, and somebody in the government has much less of an incentive to deny me treatment. And so, you know, people who, when they make it to Medicare, they're, oh my God, I made it to Medicare. And they're happy, right? So here's health rankings. Many people find it hard to believe that the United States performs poorly on most measures of health compared to other high-income countries. But the truth is, study after study supports the same two conclusions. The U.S. spends more on health care, but has worse health outcomes than comparable countries around the globe. This holds true across age and income groups. With the United States, there are unacceptable disparities in health by race and ethnic group, county by county, and state by state. So, here's what people have told me. So you're going to get better healthcare outcomes for less money. Is that possible? Yes, because you take out the parasitic health insurance companies, you regulate big pharma so they can't jack you like they do every other time. Oh my God, I get so screwed on big pharma. But what a lot of people say is, well, Jimmy, you hated how they ran COVID. Now you want to turn everything over to those people? No, COVID was run by big pharma. That's why we had the policies that we had. Joe Biden didn't mandate an experimental. They all did that without Medicare for all. We already had that stuff mandated. We already got screwed over. We already had lockdowns. We already had, you couldn't travel. You couldn't eat. You couldn't go to a restaurant. You restricted everything unless you had this. So that happened without, and they didn't give us health care. So, you know what I'm saying? So let's at least get health care if they're going to fuck with us so hard like that. So that already happened. It's not going to get worse if we're all guaranteed health care and we're not going to go bankrupt because of it. Anything to add to that, Paul?
Just that the printed money in America causes everything to rise to extreme highs that are unaffordable, and that is the entire spectrum of everything you would spend money on. So when you're comparing what we have to spend on the same procedure perhaps here in the US versus Italy, and Italy's a hell of a lot less, it's because the cost of living for Italians is easier to get with than it is for us here in America. As our government, the center of ineptitude and duck and cover ideas, prints more money to pay its bills. Like, just think, like, just pretend you're in a diner, it's 8 a.m, and some guy just runs into the diner and starts screaming, they printed all the money. They printed the money. They're paying bills with printed money. And it was the first time you ever heard it. You would just drop your fork and you would be like, what? They printed 34 trillion to pay the bills. What? Wait, why? Who? When did? What? Who thought of that? That's your government. So don't go to them for solutions to the problems. We can't. We have to band together. Some people out of this audience hearing this, some big-time capitalists might think, God, what if we started a different kind of insurance company that connected 50 million people in all these different states that might struggle financially? How can we have a different business that isn't really the insurance business? Maybe it's a little bit more like a bill-paying, financing business of some kind.
Like a co-op kind of a thing is what you're saying?
Something, right? Some different kind of collective, because the solution is not going to come from the government. They spent $500 million building the healthcare website and spent another $500 million fixing it. You could have built 10 eBays for that.
So I just say we start the insurance pool.
Yeah.
Because right now we're in a monopoly anyway, right? So you only have one or two choices, and then they monopolize which doctors you can go to. We live in a monopoly.
Yeah.
Right now, so that's horrible. So I say, because I say Australia's system works well. Now there's lots of problems now in UK. I don't advocate that system, right? That is a government run system. But I say we start the insurance pool at the Atlantic and we end it at Hawaii, right? We get the biggest pool possible, and that's called Medicare for all, and we all pay into it, and we're all covered when we get sick. Yeah. And this is doable. And if we had someone to run it who's not a bought piece of shit, like if we had like a guy with RFK's sensibilities and that we could get something done.
Maybe if we didn't have to pay wasteful taxes, if we could just have that money, we could finance the healthcare system with money the government's going to waste anyway.
That's right. All right. Well, so there you go. I'm a big supporter of Medicare for all. Maybe not this exact system, but certainly one of them. And Big Pharma is running our country, and they're running our government, that's for sure, and they're running our media. And that's why we're living in the world we're living in medically. Anyway, Paul, thanks for coming in. I appreciate it. It's good seeing you as always.
Okay.
And everybody check out Paul's Substack, thepaulstone.substack.com.
Now, as we go, could I ask you for a piece of advice?
Sure.
All right. So, I'm sometimes a sensitive guy.
Okay.
And people in my, in my orbit pick on me very often for not being funny enough when I talk about this doom and gloom information, right? So I was begging in a very humble side. I wanted to start at the beginning of the show, but I wanted to say, Jimmy, maybe between now and the next time I'm on, or you could text me some pointers. How can I be funny covering this horrific
you had a big
problem?
laugh. You had the biggest laugh of the day today when you said that Alan Greenspan had a vaccine. That was a nice joke.
Yeah.
There you go. That was nice.
That was good.
And ask Todd Sawyer to write you some one-liners.
Yeah.
That's what he's good at that.
I talk to him often.
Okay.
So, well, thank you very much for having me back. It's an honor. Truly.
Okay, great to see you, buddy.
Yeah, great to see you.
I believe that having a substantial percentage of my financial future secured with gold and silver. That's why I decided to partner with our sponsor, Colonial Metals Group. They helped me set up a safe and secure self-directed IRA where I have access to my assets no matter what the stock market, or for that matter, what the government's doing. Let the team of experts at Colonial Metals Group help you protect your family's future. We've put together a special offer for our audience. Click on the link in the description below or call the special 800 number and you'll receive a safe and up to 10 grand in free silver. Is that possible? Why don't you call them and find out? Go to colonialmetalsgroup.com/Jimmy-Dore-Show or call 888-910-1419. Hey, I'll see you on tour in Las Vegas, Chicago, and Grand Rapids. In Chicago, it's stand-up and a live panel show. Go to jimmydore.com for a link for tickets and make sure you go to jimmydore.com.